Peptic ulcer disease is the medical terminology used to refer to ulcer conditions that affect either the stomach or the duodenum. Peptic ulcers develop as a result of a breach or a break in the layers of the stomach, which can be brought about by the corrosive effects of the acids in the stomach, secondary to other underlying causes. It's among the most common day-to-day illnesses faced by individuals, with quite a number of causes and risk factors. And commonly, the commonest cause for peptic ulcer disease is infection with a bacterium called Helicobacter pylori. Then we have prolonged usage of certain drugs like the non-steroid anti-inflammatory drugs, where we have drugs like ibuprofen, piloxicam, lonoxicam. On chronic usage, it predisposes an individual to develop these breaks into the layers of the stomach, causing the peptic ulcers to develop. Then the risky lifestyles, for example, consumption of alcohol in large amounts, excessive smoking, and usage of caffeine in large amounts also poses a risk to developing these peptic ulcers. In addition, we have stress. It could be psychological stress from the day-to-day stressors that you face as an individual, or it could be physiological stress from a highly demanding medical illness. For example, you've got multiple traumas from an accident. It could be someone who is bedridden from a stroke. It poses a high demand on the body, which plays a role in the development of these ulcers. Peptic ulcers can manifest in several ways, and commonly it manifests with a gnawing or burning abdominal pain, which is located in the upper side of your abdomen. This pain usually occurs after a meal. It could be immediately after a meal, or it could be 3 or more hours after a meal. It's the kind of pain that wakes you up in the middle of the night or abruptly from sleep, and you're having this pain in the upper side of your abdomen. It can also manifest with central chest discomfort, which we could mistake to be having a cardiac problem, but when it is the peptic ulcer causing it. Then also it can manifest with a vast range of other non-ulcer conditions, which we term as the dyspeptic symptoms, where you could be having bloating, having excessive gas in your abdomen, feeling of abdominal distension. Okay, in early satiety, you eat a small amount or portion of food and you feel you're satisfied. Then also fat intolerance. In certain individual, it will manifest with loose stools after every fatty meal that you take in. Then in overt cases of peptic ulcer disease, these are individuals which start to vomit blood. There are those who will pass blood-stained stools or dark brown foul-smelling stools, and also progressive difficulty in swallowing. Every time you're swallowing, you feel a sensation of food stuck in your throat. Those are cardinal signs of worsening of these peptic ulcers. To prevent the development of peptic ulcers, we can play around our lifestyle. If you are binging on alcohol, take alcohol in lump sums, reduce on your alcohol consumption, then reduce on the caffeine intake. You can also make sure that you have your meals in time. And for individuals, if you have any of the above signs and symptoms, you can visit any of our CCare IMC branches where appropriate medical assessment and investigations can be done into the underlying cause, and the right medical treatment can be instituted. All in all, peptic ulcer disease is a curable illness, provided that the underlying cause is known. Thank you for always choosing CCare IMC for all your healthcare needs, and thank you for listening.